I've got an olive complexion. I tan very easily when I go out in the sun. I've played a lot of sport in my youth, played a lot of cricket, and about a year ago I started to get a little crusty scab on the side of my nose. It didn't look like very much. Fortunately, being a dermatologist, I was able to take photographs, show it to some of my colleagues, and in the end we decided that it probably needed a biopsy, and it turned out to be a BCC. And even though it was probably no bigger than about 4 or 5 millimetres in size, I caught it very early, partly because it was right in front of me. Every time I looked in the mirror, it was right on my nose. And it was cut out by a plastic surgeon. There's a very nice, neat scar along the side of my nose, and I'm very thankful to my surgeon for that. But it hurt. It was not pleasant. Someone who's been on the other side of the syringe and the needle for many years, I didn't realise how much it does sting. It certainly brings a tear to your eye when you have the local anaesthetic. Once the local's in, it didn't hurt after that. But I was very fortunate because I was probably only a couple of months away from it being too big to be sewn up as a straight line and needing a skin graft, which would have meant that it would have changed my appearance forever. If you're fortunate and you act quickly, then you might end up with a scar that's barely visible like mine. But if you delay treatment, delay the diagnosis, then the consequences can be dire. And so, having had a skin cancer, I know that I'm at increased risk of getting another one. And so that makes it even more important that I stay in tune with my skin. I'm familiar with what's on my skin, what's normal, what belongs, and identify anything that's different, anything that's not quite right.